Welcome to our session on career opportunities in healthcare. My name is Adrienne Slash. By day, I'm a talent management professional at Community Health Network, and by night, many know me as a community resource. And I am super excited to be here with this wonderful panel as we talk about career opportunities in healthcare. So first up, I'll have the CEO of the Health and Hospital Corporation share with us a little bit more about himself, Paul Babcock.
Well, thank you. I really appreciate the opportunity to be here and talk about this important topic, healthcares and careers. I'm Paul Babcock, CEO of the Health and Hospital Corporation. I have the pleasure of overseeing the public's health and hospital system. So we oversee Eskenazi as well as the Marion County Health Department and the long-term care division. And what little known, I think, to most people also is the Indianapolis Emergency Medical Service, so the ambulance throughout most of the city. We are arguably, and I think probably some of my colleagues may disagree, the first integrated health system here in the state of Indiana from, since 1960 on when Unigov created us. And so as we continue to, move in the 21st century, look forward to working with everyone in the city to help better the health and well-being of the residents of Marion County. As a safety net system, we have the obligation, but I think also the pleasure and the joy of being able to help a lot of folks in this community get a better life and get healthier.
We'll hear plenty more from you as our time goes by. Next, I'd like to introduce Angela Smith-Jones, Vice President of Diversity and Inclusion at Health and Hospital Corporation.
Good morning. Good morning, everyone, and thank you, Adrienne, for being the moderator of our panel. As indicated, I am currently the VP of Diversity, Equity, and Inclusion at Health and Hospital Corp. And my role is to really intersect and integrate the real values and the culture of diversity, equity, and inclusion throughout all of the entities of Health and Hospital Corporation. As Paul indicated, many of you know Eskenazi Health, the Department of Public Health, IEMS, and Long-Term Health Care and Corporate Health Hospital Corporation. Prior to that, I was Deputy Mayor of Economic Development, and there did lots of work intersecting the values of diversity and inclusion in workforce and talent, in economic development, in our ecosystem with regard to small entrepreneurs that are either ethnically diverse, owned by women, veterans, or disabled persons, and work with our international community and international delegations. So all of that together to let us all know that each one of us is critically important and that there are opportunities for us to get into healthcare. And thank you so much for having me.
And last but certainly not least, Nicole Wilson, Vice President of Integrated Primary Care Ancillary Services at Community Health Network.
Good morning, everyone. I am Nicole Wilson. I am Vice President of Integrated Primary Care and Ancillary Services at Community Health Network. And in my role, I oversee all of the strategy and operations for one of our largest product lines, which is our primary care and ancillary services product line. So I oversee our operations and strategy for primary care, pediatrics, as well as our urgent care. We have clinics in Walgreens and many of the other ancillary services such as physical therapy, outpatient imaging, infusion, and our partnerships in the community. I know that we have a great responsibility within our product line because we oversee hundreds of thousands of lives that enter into the healthcare system. One of my passions is making sure that we're thinking futuristically about how we're transforming healthcare in the future to meet the needs of our patients in underserved communities, as well as to meet the needs of our patients from a consumer and retail focus. So I am excited to be here today because as you think futuristically about healthcare and the direction we're going in, the direction we're transforming in, I'd like to share a lot a little bit later on about some of the non-traditional roles that we have in healthcare that are available and that we're going to need in the future.
Thank you. So I hope everyone's looking forward to this wonderful discussion as much as we are. Nicole, we're hearing that there's a little bit of difficulty in hearing you, so you may have your hand near a microphone or something on your desk. I don't know. But I'll kind of keep you posted on that. And thanks for the folks in the chat that shared that with us. We'll do our best to manage that as best as we can on our end. So let's go ahead and dive into the conversation. Our country is increasingly diverse, and those communities will result in more diverse patient populations moving forward towards a majority-minority balance by 2045. Currently, those changing demographics are reflected in hospital patient populations, which we've all been able to see. And yet, this increasing diversity is not reflected in healthcare administration leadership. So let's have a nice little conversation. I think we have the right people in the room to do this. What do we see locally in Indy and across Indiana? And how about we go ahead and we start with Nicole, and then we'll kind of move around the rest of the panel.
So hopefully you can hear me. Great. I'll use my outside voice, or my mom voice, as I call it.
Yes.
So locally, I think I can speak for all of us to say that we probably agree that we have a lot of work to do in terms of continuing to diversify our leadership ranks across all of our health systems, our boardrooms, our C-suites, our senior executive ranks, all the way down to manager and director levels. We do have an opportunity to better reflect the community we serve. I know the system that I'm a part of, and as well as Eskenazi, we have combined along with IU Health to really come together to pledge that we will end systemic racism within our healthcare settings. And part of that pledge does include ensuring that our pipelines of leadership are diverse for the future. There's a lot of conversation about health equity, because that's the most important topic, and making sure that our community is getting the equitable health care they deserve. And the only way that we're going to be able to sustain that in our systems is to have a workforce and a senior leadership and boardrooms that know how to ask the right questions, that are there looking out for all populations, and that are here to hold ourselves accountable. So I just feel like we have a lot of work to do. I feel like there's a lot of collaboration we can do. This shouldn't be an area where we compete in terms of healthcare. When it comes to health equity and sustaining that, this should be more of a collaboration, but we have work to do.
Thank you. And that's kind of like a long answer short. There are several more questions that we'll have that will go a little bit deeper. So if you're wondering how much further can we go on that answer, because it's a loaded question, we'll get there, I promise. So Paul, I'd like to kind of send this one to you. What are you seeing locally and across Indiana? Because I'm sure that Angela's got a lot to talk about here. So we'll go to you first, and then we'll let Angela close this question out.
Well, I'm just going to end up deferring to Angela because she has all the information. She's way, way, way more knowledgeable on these things than I am.
Well, perhaps you want to address it from as a leader.
Yeah, no.
What do you see as a leader? Because I'm sure that a lot of the audience today has that question. Like, as the CEO, what do you see there?
So I would say two things. One, leadership needs to be intentional. I think, that really echoes what Nicole was saying. But two, the way in which leadership and systems are intentional is even more important, right? So, a couple of the things that Angela and I have talked about, just from an example of what we're trying to do here in our system, and then I think this speaks globally for what needs to be done, is we're trying to design pipelines and programs that go into our diverse communities and present healthcare opportunities, and not just say, hey, such and such, you can come get a job, but actually incentivize someone to say, we're willing to help you and facilitate you if you want to come work for us, because we know we need diversity to be able to perform our mission to the highest level. So, not to steal any of Angela's thunder, because that's one, impossible, and two, something I would never do. But we're working from an IEMS, our ambulance standpoint, knowing that we have a diversity gap, to get into high schools and offer opportunities for young students to get an EMT certification paid for by the corporation, to then help them become paramedics, also paid for by the corporation, to then get them on our ambulances to where, at the age of 21, if they still want to be on the ambulance, they can. Not, they can go become a firefighter because they've got the requisite skills, or they can go to college. And, part of the thing we do in the corporation is we cover the cost of education. So, we are trying to be more intentional about how we actually get out into diverse communities and offer recruitment opportunities to really get folks into our system, to have our system better reflect the people that we serve. So, there's a couple other plugs I'll give later on, but there's just a shortage across the board in medical professionals, all up and down the spectrum. And I think if we do this right, and if we're intentional as leaders, we can really tap into, I think, diverse communities to better reflect who we serve. And I would say that if you look at the literature, a better reflection of who we serve ends up leading to better health outcomes. And, that ultimately is our goal as a system. So with that, I'll have Angela actually, take it away.
Bring us home on this answer. What do you see locally and statewide?
First of all, well done, Mr. Paul Babcock, my fearless leader. He's actually right. Part of our strategy, and Paul and I work very closely together, which is really the foundation and the essence of how you're able to impact this space. Your leader has to be on board with including diversity in candidates at all levels. That's the first step. The second step that Paul did highlight is we are being more creative and innovative in how do we look at all levels of opportunity within our organization and who are possible partners in our community to help us attract talent. So we're looking at high schools. I've even met with IEMS and our team and saying, how do we take time to go into the middle schools and start to inspire the students at a very young age, 5th, 6th, and 7th grade, and saying, you could be a paramedic, you could be an RN, you could be a physician. And this is what I do in my role. And these are opportunities for you as you go forward to help inspire them. Very often students get discouraged, even in the middle school level, that they cannot be a physician where they actually can and they have that requisite skill set. And we're also looking at our recruitment efforts. Where do we recruit across the nation? And we're working and closely with historically black colleges and universities at opportunities to bring in talent at a higher level. So we're looking at middle school, we're looking at high school, and we're looking at college students, because that talent pipeline begins early. And we really, as you clearly indicated, Adrian and Nicole and Paul said, we really need to start to diversify our workforce at every single level. And then lastly, looking at what are promotional opportunities within our organization? How do we skill people up and support them so that if they're already working for us, how do they get the RN certificate licensure or go back to school to become a physician or what have you? So I want to make sure we get some other questions, but those are the things we're doing.
Yeah.
I'm going to kind of keep floating here just a little bit. We do have a next question, but this is a very nice hover, and I want Nicole to be able to get in here. I love all the conversation about pipelining. I love all the conversation about really building intentional partnerships. I think that our audience will really enjoy that. But Nicole, I know you've been involved in an innovative approach at Community Health Network to use the talent that already exists. Can you share a little bit more about that?
Sure. So one of the things that we recently launched at Community Health Network is a African American Legacy Fund for our own healthcare workers. And this came about last year, where a few of us during the time of George Floyd were pondering what more could we do, and not necessarily relying on what can our network do, but what can we as the African American leadership do to help other brothers and sisters within our network. So we went to the foundation, wrote a proposal, and fundraised from our own African American employees a scholarship fund. And we just launched that to our internal employees who are looking to rise in the ranks of a Community Health Network or in their healthcare career. And in 2 weeks, we will be giving a lot of scholarships away for people to advance themselves. And the beauty of it, it was by us, for us, with an intentional look at legacy and creating those pipelines. So we came to the organization and said, we are serious about this. We hope that you are serious about this. And we put our money where our mouth was to make sure that those employees felt that other African Americans who were in some level of leadership were looking out for them.
Awesome. Thank you so much for sharing that. I think that there's always a lot of conversation about we need more people, but there's not very much conversation about what do you do with the hidden talent that exists within the ranks. And so I would also, this is me adding in another question because they gave me the opportunity to do so. But really like spending some time there. So do you see that it is a part of what our industry is actually doing, that people are paying attention to potentially the systemic racism issues or potentially recruitment issues that would lead some really great talent untapped or underemployed inside of our systems? Does anyone have any thoughts about that? I know that's like a left field question, but essentially creating a fund that helps people access whatever credentialing or continued education that they need to climb would also speak to the fact that there might be some untapped talent inside of our systems.
There's absolutely untapped talent, and that's what we found. I mean, even when we opened up our application process, we had over 79 applicants for these dollars. And a lot of times, because of the economic disparities, our people cannot get through those last legs of programs and things that they need, whether it be technical, and we opened it up for everything, technical all the way to educational, to professional leadership development, whatever would be good for that person to excel professionally. But there is a lot of untapped talent. So it is hard when, as a senior executive, you hear there's not talent out there. There's not diverse talent out there. Sometimes you have to be willing to plant a seed and groom the talent and hire people off potential and give them a chance. So there's a lot of untapped potential out there. And a lot of times I have seen many of my colleagues who will take a job somewhere else across the country because there's not opportunities that they feel are here for them. When we talk about all of those things, those pipeline programs, working with HBCUs, especially as it pertains to Indiana and Indianapolis, I just feel like as systems, there's opportunity to have greater impact if we work together to bring talent here to our state and keep talent here, because it impacts us all.
Would anyone else like to take a stab at that question? I know that I pulled one completely out of the sky that was not necessarily in our prep work, but I don't think that it's fair for us to talk about building talent from middle school and high school and not considering that in the thousands upon thousands employees that we already have, that there might not be some diamonds in the rough. So if anyone, I'll just give it an opportunity. If anyone else wanted to chime in there, please feel free. If not, perhaps you can slide it into this next question. So studies suggest that diversity in healthcare leadership can enhance the quality of care, quality of life in the workplace, community relations, the ability to affect community health status. We've talked about that just a little bit, but to go a little bit deeper, knowing this and its correlation to improving access to and overall care for our most vulnerable population communities, how deep does this really go into serving the community? Knowing what we know. Why is it so important that we're doubling down on this and that we're really committed to making a difference? So remember, I told you we were going to have plenty of time to go deeper. Let's take a chance and go a little bit deeper. Why is that even important for us to affect change and really acknowledging what we know about the quality of care, about quality of life, experience in the workplace, community relations, and how it all goes when we're talking about diversity among the workforce?
So I'll take a shot at that, and since you've been throwing questions out of left field, I think my answer may come out of left field, if that's fair. So I guess I would make the argument that, if you look at the last 60 years of healthcare reimbursement, right? And I'm putting this in monetary terms because to some extent it may help understand the health outcome perspective. Yeah, everything's been fee for service, right? So no matter, and what that means is if I show up at the ER, you're going to get paid for performing whatever on me, and then you send me home, right? That's been 50, 60 years of healthcare. But as I think the reimbursement models are changing across the country to where people are saying, well, that really doesn't make any sense. Like, we want to make sure that people have quality health outcomes so that they don't come to the emergency room. We actually have to take the time to meet them where they're at, which is at their primary care provider, or it may just be in their house. And to be successful at bridging that gap, a lot of that requires cross-cultural communication and understanding to where, if you're going to, let's say, for example, the Meadows, and, you're actually from, no offense to anyone on the call, from, let's say, Greenfield, and you've never been to the Meadows before, and you knock on my door, if you don't have the ability to communicate across cultures or across environments, across demographics, socioeconomic status as a provider, you're not going to be successful. And what's going to happen is that person you're trying to serve is still going to end up in the emergency room to deal with their basic primary care issue of they didn't take their insulin for the last 3 days, and they've gone into shock, or they forgot to refill their prescription for blood pressure medicine, and that their blood pressure's gone through the roof, and here they are back in the emergency room. So, and those are really simple things that from a health outcome standpoint make a world of difference. But to actually get someone to do that in this changing environment really requires that ability to communicate effectively across cultures and across socioeconomic status in a way that healthcare for the last 60 years has not really, in my opinion, thought much about until probably the last 5 or 6 years in a constructive manner, right? It's been on the fringes of thought and journal articles and whatnot, but now it's really seeing, for better or for worse, as people, and it's really the federal government, changes the way in which we are reimbursed or we're paid. It's really forcing a change in the way in which we provide care, and the only effective way to do it is actually meet people where they're at across cultures. So hopefully that makes some sense.
That was a wonderful answer. And one of the things that I think is super important when we're having this conversation is, acknowledging the fact that most of our providers and most of our folks providing care might not have come from inside of those communities because the recruitment hadn't been done there, or maybe there were some gaps in pipeline building and planting seeds really early. And so let's continue down that line. Let's talk about other things that we can do and the impacts that they can have by really recruiting those kind of candidates that look just like the people that are being seen.
Adrienne, I'd like to kind of comment a little, kind of piggying back on what Paul said, and then also we can get back into the talent attraction component. But one thing I find, someone had asked me the other day, how does education impact healthcare? And I was like, oh my gosh, how much time do you have? If you think about it, as Paul said, if you're from a remote area that typically is not very diverse and you're coming into one that's culturally different, a really key component is instituting what I would call cultural sensitivity or cultural compassion in our education system, especially in the healthcare systems, right? Healthcare education systems. But it also goes all the way back to the teachers that are teaching our K-12 students. So if they don't inspire in those students the capability to become a physician, and then say they didn't, but when you're in medical school or nursing school or physician's assistant school, there is no cultural compassion or cultural sensitivity that's being taught and exposure, then as you matriculate through those healthcare degrees, when you are placed in a community such as ours and you come to work at Health and Hospital Corp and any of our entities, then you have that unawareness and you cannot communicate with the patient. It also goes to me as far as what type of testing do you do? So if your practitioner doesn't know, for example, Black women very often have a deficiency of vitamin D. But if your practitioner has never really understood differences in ethnic propensities for deficiencies in vitamins and minerals, et cetera, they're not going to test for that. And therefore, as Paul said, instead of you being treated properly in a preventive care way, you get into a crisis mode where then now you have to go to the ER. So I do see that education and healthcare and that cultural competency or cultural compassion, I think is probably even a better way to say it, really goes a long way in delivering proper healthcare.
Nicole, would you like to chime in at all?
Sure. I think when I hear what Paul mentioned earlier, the first thing that comes to mind is trust. We have to have those pipelines, and we have to have practitioners that look like the community, because it is a basis of establishing trust. Like, I know that this person is likely going to have my back or will at least know something more about me that maybe a non-minority provider would know. We have in our system pockets of where we have a large amount of Burmese patients and Chinese patients, and they go to one of our highly thought of Chinese providers. And I mean, they will come from wherever they live geographically because they know from word of mouth that she excels at taking care of their needs and that they don't have to worry about their cultural needs not being met, and how that inclines and intertwines within your health and everyday health. I think about my grandfather. My family on my dad's side is from the Virgin Islands and Puerto Rico. And he very much felt that whenever you were sick, you needed to get some aloe leaves from outside and you needed to take a dip in the ocean. And the ocean could cure anything. And, you know, my grandmother, who is 101, who thinks Vicks Vapor Rub can cure anything. You know, so we have to make sure that we have people who understand and get those stories and can build that trust and bring that into reality for their healthcare and help turn the table. Yes, you can use your Vicks Vapor Rub, but you're also going to have to take this medication.
Thank you so much for that. I think that the way that we're approaching this stack of questions that we kind of have is really starting to make a nice little turn in a transition. The next big question, and I think that all three of you really are in the position to deal with this question. I'm on the talent management side of things, so I teach people how to adjust and make their career happen. But the three of you are actually in positions where like you can deal with hiring and setting norms and sharing, you know, what an ideal state or best practice could be for hiring. So I'd love for us to talk about hiring while we're here. And so one of the things that I think is a good action, you know, not only do we build the pipeline, but what happens when a person captured that seed in middle school and decided I'm going to do this, and they followed through. Maybe they didn't get the world's greatest grades, but they're passionate and they are ready, even if that means that they're coming to us at the lowest level clinician area, but they plan to work their way up as they make more money. Can we talk a little bit more about what can be done in healthcare, or what you're seeing be done when it comes to actually answering the question of, now that we've done the recruitment, now that we've planted the seeds and built the pipelines, how do we get people hired and do so in a thoughtful, meaningful way to address those numbers that we would like to see? And I would like to this time start with Nicole, if we.
Sure. I think to me, it is clear when you do have people who are diverse, who are in those decisions, you do see a lot more diversity being brought to the table. And you do see a lot more diverse hires in those following ranks. So while we are in the positions that we are, for myself, Angela, and others of color who are in those top positions, we really have to press the issue with HR. And I am definitely the person that does that in our network, to say, I need some diverse candidates and bring forth to me a diverse candidate. Have you looked here? Because sometimes, because that has not been their practice to search in the areas of where there is diverse talent, we have to help them along the way. And I have no problem speaking up to do that. Within my area, I have been able to bring some diverse people to the table, which is awesome. And we just need to continue to perpetuate that. One of the other things that I am working with, and this again is a collaborative effort where we have a representative from most of the major health systems here in the city, is we're trying to establish a chapter, a local chapter of an organization called NACI. NACI is the National Association of Health Services Executives. They have a national footprint around the nation and major cities with grooming Black healthcare executives and addressing health equity in the community. And we have been working with them for the past several months to see if we can get a chapter here. That way, when we identify folks who are on our pipelines for hiring. There are courses and curriculums that NACI has that have been taught around the nation to help them prepare for the C-suite, because a lot of times you hear people are not prepared. People are not, oh, they need another chance, or they're not quite there yet. Well, let's bring some programming to our folks so that they are better prepared and that they have seen what all of the leadership possibilities are in that healthcare landscape. Because if we don't do that here, somebody else is going to pluck them from another state.
Thank you for sharing that. Now we're going to toss it to the other health system in the room and see if either or has a place where they'd like to chime in here, because I do think that we would all, be pretending here if we didn't say that there had to be interventions when it comes to hiring and hiring practices to actually move the needle here. So Paul or Angela, either of you like to chime in here?
Angie, you want to start?
I was just going to say, I'll do cleanup. So you go ahead and then I'll go last.
I think there's a couple of things that we probably need to figure out. And that one is that we identify diverse talent. You have to identify jobs and make plans, career pathway plans, right? So, have to be intentional about how, if you recruit someone, be it even at an entry level, offering and showing ways in which this position, provides a path to go to the next level, to X, Y, and Z. How do you get there? I would say that as a governmental entity, we're probably not the best at that. I don't have a problem admitting that where the warts are. And that's definitely one of them. And that's something that we're, trying to focus on. And then I think too, it's figuring out how to promote sometimes opportunities that people just don't generally think about no matter what. And I will say that, one of the opportunities that we're really trying to, recruit folks for, because they are challenging, is, our long-term care division and senior care. We have a number of open positions across the state of Indiana when it comes to senior care and working in our facilities that we run in partnership with our partner ASC, taking care of some of our most vulnerable citizens here across Indiana. And there's a number of gaps in employment there that need to be filled. And it's just trying to figure out how to get folks into those positions is really something that we're working on. And I would say that the interesting challenge about the discussion of diversity and filling, the pipeline with diverse talent is I think the pandemic's kind of highlighted that, to where, from a brass tacks standpoint, we struggle to recruit nurses into our long-term care facilities, because now, and I think Nicole's system is probably facing the same challenge, we're competing against these traveling agencies, to where, at one point, $25 to $30 an hour for an RN was a really great salary. It was actually above fair market value. And that's what we were offering to recruit folks. And, I have friends now in the industry who are getting paid $150 an hour to go to Chicago. And, that's really changed the economics for us. And, as you think about pipelines, I wonder if there's just talent that's been, one, that we can't recruit because they're already getting paid more to go somewhere else. And two, have we lost the opportunity to get folks even into those traveling positions to get paid well, get the experience, and then come back? And so, those are some of the things that, we're wrapping our brains around here at the corporation, along with developing a better way to help advance people through the pipeline, right? And I think that's served me well. I've been fortunate, and maybe that's because of the position in life I've got. But I want to be able to pay that forward to other folks, so that, when my first job was at the health department, came in, and now here I am at the top, but I got lucky and had a great mentor in Dr. Kane to help work me up through the path. And, we need to be better at that here. And that's kind of one of the things that Angie and I are talking about. And with that, I'll let her back clean up, because I'm sure I said a bunch of things. That
Here you go. Here we go.
You did great. I was going to thank you so much for this question. So for me, one of the critical things is working with everyone in your system, because sometimes of positions that are becoming available before they are. And then once they're posted, there's an opportunity to communicate that out. And Nicole said this perfectly. As persons of color, it is so critically important that we advocate for a diverse panel of candidates and applicants. That's the very first step. And one thing within that is very often HR systems will utilize that algorithm, right? Like you have to have 5 to 10 years experience in a major healthcare system in a major city and da da da. So all these algorithms, and they can't translate, like Nicole and Paul and I are saying, if you've worked at a public healthcare institution, or if you've worked at a different system, but you have the same characteristics and traits of leadership that you really want. So that's another key step, is working with HR and understanding, let's back out of that. Let's look at the real skill set. Because often if you do that, you're continuing to perpetuate that systemic racism, because we weren't even allowed in those professions to have done that level for the last 10 years, right? So that's one thing. Another is working with organizations that you know have a reach into diverse communities. So I know with Paul and I, when positions are posted, I will take that link of the job description and communicate it out to Prospanica, to the Black MBA, to my sorority. So I'm trying to get the word out. Very often we don't even hear of positions and we're actually overqualified, but nobody told us. So I think that's another key component, is getting the word out to our sororities and our fraternities and other ethnic organizations. Another component, once you attract that sharp talent, is what is your onboarding like? How is the culture of your organization welcoming and inclusive? And of course, that's the work that I'm embarking on in a deep way. But I think it's important for those of us on this call and anyone else, look at your current culture. What can you do to support people who are coming from another country or diverse culture of anything? And then the other key component, which comes down to dollars, is looking internally and promotional opportunities. What's professional development like in your healthcare organization? What kind of dollars and opportunities exist? And are you communicating it clearly to your team members? So there are plenty of places where we have all worked where you, as Paul said earlier, we offer reimbursement for tuition, but does everybody know that? I don't know. In your organization, are there professional development opportunities given, say tech space, right? Everybody needs a tech refresher, but does everybody know that they can take that course and be reimbursed? And then if you can, how are you doing the reimbursement? Is it before or after? Because if you look at some income levels in your organization, I can't find $1,500 to take that class, but I need it and I want it. So is it reimbursement, or is it we'll pay for it and you have to get the grade and then you owe us back? So those are things that I'm really kind of thinking outside of the box, and that was a lot, but I do feel like those are things that those of us in the healthcare space can really unpack, and that will really provide us an opportunity to attract talent, keep talent, and promote talent.
I think that's a wonderful answer, even if you feel like it was a mouthful. It's extremely important that we have that conversation, and I'm sure that our audience is truly appreciative of all the thought that went into that answer. So we are really, believe it or not, coming down the home stretch of this conversation. But one thing that we do, we still have a lasting question that's a part of what we wanted to cover here today. And so we've talked a lot about planting the seeds. We've talked a lot about building the pipeline. We've talked now about what needs to be done internally to make sure that, in the hiring process, this is cared for. But what about encouraging, and making more opportunities for our most vulnerable population to really consider the jobs that we have? So I'm not necessarily sure if the majority of our community truly understands there are thousands of jobs in healthcare that are not doctors, RNs, or clinicians, but extremely high wage positions that exist that you could also aspire to. So how do we encourage people to try for those?
I think exposure is key. When you think of health systems, you automatically go to nurse, physical therapist, physician, but there are some real needs forward facing for the future of healthcare that lie outside of those clinical traditional roles. Healthcare analytics is huge. For us to be able to have a strong analytics platform and strong analytics thinking environment is huge. We do have roles as we are looking at our community benefit strategy and doing what Paul said, meeting people where they're at, being in the community. We hire people from the community to be health advocates for those in the community. So those are people who, live with those who have health issues and live in those neighborhoods and can get the feedback from them and use a trusted face and trusted known person to help guide them through the health system. Healthcare navigation is going to be huge and is huge. There's a lot of things future facing in the digital world that healthcare is quite behind in. So digital marketing, all of those young people who are on Facebook, social media, all of those platforms that have thousands of followers. Well, we need you in healthcare because we need to be able to connect to every audience, whether we're doing it directly in their neighborhoods, whether we're doing it through social media, whether we're doing it through our traditional recruitment chains. We need all of that talent at the table. And so just the plain exposure of healthcare, of the new healthcare, and what is needed to run a health system does need to get out there a little bit better. And when we have these pipeline opportunities, we need to promote those opportunities just as much as we do the healthcare side.
Thank you for that.
Nicole hit the nail on the head. I think it's exposure to everything. So I always like to equate it with Starbucks. Like my son went to school with this kiddo who had never had a Starbucks. And he was like, oh, he didn't know that. My son didn't know that. But he was like, hey, Tom, or whatever, let's go to Starbucks and my mom will pick us up and we can go to the baseball field. And the kid had never been to Starbucks. And they went and they fell in love. So that's the thing, is you have to expose people to opportunities in healthcare. And I actually think I would be remiss if I did not mention this opportunity in healthcare, which is mental health care. We have such a deficit of, ethnic, diverse leaders in mental health care. And that's a whole profession that you don't have to be a physician to be an excellent mental health care provider, but it is a way to serve your community and your people. So I definitely want to put a plug in for that.
And it pays well.
And it pays very well, very well. And I was also going to mention tech because when I've as deputy mayor, I worked a lot in the tech space, in the tech sector. And what most people don't realize is tech intersects every single profession out there. And if you are proficient in tech, and there's an excellent academy that you can go if you're slightly interested, you can literally become a key leader and partner in your healthcare system and really add great value when you're looking at social determinants of health, helping to build systems where healthcare systems can talk to each other and better understand the demographics of the patient and the final product of how the patient's healthcare and their outcomes are after receiving specific healthcare. So Nicole, I just had to echo everything you said, that absolutely, I just feel like expose, experience, and then there's so many great opportunities. Okay, Paul.
I think you all summed it up really well. There's nothing for me to add. I mean, I would just point out that healthcare is almost 20% of GDP, so there's going to be a large amount of disruption in the next 10 years. And with that said, people need to, if they want to be involved in healthcare, think outside the box, because it's not going to be the same 10 years from now. I mean, your Apple Watch can probably do more than your doctor can in the next 5 years. So that's what I
agree with what Paul says. A lot of my job is focused on the future thinking and how we can innovate our current system. And we are not only competing with other health systems per se, but we are competing with small startup organizations that come up with a healthcare app that innovates and turns out our whole world. And so we as systems have to be thinking about that and bringing those ideas to the table. We have to be more nimble and move faster because there's opportunity for healthcare entrepreneurship to come at play. So even some of those, up and coming entrepreneurs, there's a lot of movement in the healthcare space. And then they create something that they then sell to our health systems, when really, as health systems, we need to be just as innovative and move quicker to those solutions for our community.
Awesome. Thank you so much for that. And before I move to our very last closing kind of space, we did have a question in the chat, and I'd love for us to, if one of you could take a stab at it, or if more than one of you would like to, that's fine. The question is, what steps beyond attaining my MBA in healthcare management should I do to prepare for transition into the corporate platform? And are there opportunities for mentorship to know where I belong? It's an outstanding question, but I know that it has multifaceted answer. Is anyone interested in taking a stab at that?
I would just add networking. I mean, the age-old adage of who you know and is still critically important, even in today's digital social media type environment where a lot of communication is done across technology platforms. It's still that human connection. Putting yourself out there and going to networking events or going and meeting folks who are involved in the field, just talking. That's the key aspect of, I think, that's a big part of it, right? Having the credentials and then just knowing somebody to be able to help get you into that foot in the door.
Thank you. And then I'll also give a small brief chime in myself, just because I know a little bit about this one. Connect with your talent management space if you're already in healthcare, and understand what their goals are and what initiatives they're already taking. And you don't have to have a formal mentorship. Ask someone to coffee. A person in this panel right here told me that. Ask someone to coffee, they'll say yes. Ask them to be your mentor, they'll likely say no.
Exactly.
I'm not going to admit to who it was, but it's one of the women on this panel said that, and it's very important. Okay, so the very last thing that they've asked you all to do.
One other thing.
Oh, go ahead.
If you're going to make a resume, please don't make it 8 font and dense like a book that I can't read, because it's not going to get read by me or by the talent person who looks at it. So I would just add that. Having read now the 20 resumes over the last 5 days for a position, I threw out 15 of them because I couldn't read them. So
that's good to know. It's good advice. Nicole, you want to chime in?
Yeah, I think that there's also, I love, the me thing, because that you can always get up pearls of wisdom and connections, and people can keep you at the forefront of their mind when they do have positions. Sometimes I have seen people, especially in larger systems, be willing to get their foot in the door in a particular position, knowing that there's going to be unlimited opportunity in the future. So just think, in the larger systems, sometimes career development looks vertical, but sometimes it goes like this. And so being mindful of that. And then a lot of people in the healthcare space do use recruiters and recruiting firms to put their name out there and get them in the right circles where searches start.
Mm-hmm. Awesome. Thank you for that. And such a true thing. Healthcare does not necessarily always look vertical. Your money can grow, but you may be moving parallel, and it's still movement. It's still okay. And so the very last thing that I've got to ask you all is, what is your call to action for our community as we close when it comes to this space? Whether it's providing the exposure, whether it's advocating or creating pipelines, what each of you would love to hear. This is almost a round robin at this point, but have at it. And I would like to, Paul, you look like you're thinking, but I think I'm going to go this way first. If you could say, what do you think your call to action for the community is as we close this?
Yeah, no, I was thinking, and so here's my off the cuff answer. I would say that one of my call to action, and what I've tried to really get the system to adjust to in the last 6 months is taking the time to hire younger talent, especially younger diverse talent, and put them in positions that have the opportunity to grow in, and I give people a little bit more than you would expect and see what they can do. I mean, I think that is my responsibility as a leader, is to challenge people who are working for the corporation to be better. And the best way to grow talent is to bring in young, diverse talent and challenge them. But I would add a caveat, right? So there's also then that mentorship thing where, if you're going to go and challenge someone to do something that you think is a little bit outside of their comfort zone, we have to, as leaders, be willing to then walk beside them and help and provide feedback and advice and get to where they need to be at that next level, right? Because you don't want to set folks up to fail. And that just doesn't solve or serve the purpose for anybody, the organization, let alone the individual. So that would be my plug in 2 cents.
All right, awesome. And it sounds like they're going to cut us off here in a second, but we're going to go ahead and get to the rest of calls to action, and then we'll stop. Who wants to go first? Just pop on in.
Go ahead, Nicole.
Sure. I think my challenge is to our health entities to collaborate more, to bring some talent to the community. It would be great to have the problem of having overflow of people that we could choose from. Sometimes we are competitive because there's very few people in the pipeline of color for positions. But I think the more that we can think outside of the box, look at what other cities have going from them, like the NACI chapters and things like that, and put together some programming that will facilitate that pipeline, especially with the schools that we have here, our med schools. We also have, health administration curriculum. I think that there's opportunity that we can create and have a bigger impact if we all work together. So that's my challenge.
Thank you.
And my final would be for exposure for those of us who are in the healthcare space to take time to go and talk with those in K-12 systems to inspire them and expose them. So that'll be the opposite side of where Nicole is and Paul, but that way we can start feeding that pipeline.
Fantastic. And it looks like we might have made it. Looks like we made it in time. I know that they gave the 5-minute warning to send people back to the main stage. But I would really love to just thank today's panel. Thank you, Paul Babcock, Angela Smith-Jones, and Nicole Wilson for everything that you've been able to contribute here. I know that you've left some gems and nuggets with folks, but also you've shined a lot of light into what is happening and what the future of healthcare and occupations in healthcare could look like. So thank you so much. And I hope our audience has enjoyed us here and that this has been a worthwhile discussion. With that being said, I believe we're going to go ahead and close out for today.
Thank you.
Thank you, everyone.
Thank you.